It's Mental Health Awareness Month, and it comes at a time when advocates are warning that essential medical services for those in need are at grave risk. The newly proposed healthcare bill that made its way through the House of Representatives would eliminate an Affordable Care Act requirement that Medicaid cover basic mental health and addiction services. Individual states would instead be allowed to decide whether or not to include those benefits in Medicaid plans. The statistics highlight just how critical this issue is here in New York. 500,000 people in the city suffer from depression, but fewer than 40% actually receive help. There's a lot to discuss, and I'm pleased to welcome the president of the Mental Health Association of New York City, Kimberly Williams, to the programme. Kimberly, thanks so much for joining us today. I want to focus on some of the state issues, the local issues, but first let's talk a little bit about this healthcare bill that's gone through the House of Representatives. The Senate still has to consider it, but as it stands, what are the implications of this bill on mental health care services here in New York?
Well, thanks for having me. Delighted to be here. We are deeply disappointed that the House voted for this piece of legislation. It has serious, devastating consequences for people with behavioral health challenges. This bill, if it does move forward, guts certain protections, key protections for people with mental illness, including around pre-existing conditions and coverage for essential health benefits. It also eliminates the Medicaid expansion and fundamentally changes how the Medicaid program is structured. Millions of Americans all around this country rely on Medicaid to access behavioral health services. Medicaid is the primary single payer for behavioral health services in the nation. So the net is that with these changes, it would restrict access to life-saving supports for people in need.
Let me read you what Representative Joe Kennedy said in response to this bill. This is the single largest attack on mental health care in recent history. He would then go on to say this is not the debate Congress should be having during a mental health care crisis. Are we at crisis point?
Well, I mean, with proposing legislation that's going to impede access, limit access for people, that's not the direction we want to be going in. We want to ensure that people are able to identify and get access to the supports that they need so they can be on the road to recovery.
The statistic I mentioned in the introduction, it really alarmed me. More than half of those who suffer from depression in New York don't receive support. Why is that?
Well, I think there are a number of reasons that people aren't getting access to the care that they need. Part of it has to do with stigma and a reluctance to identify and talk openly about these issues.
Why is that? We're comfortable talking about physical ailments, physical illnesses, but still mental health care issues, we're not willing to talk about it. Why is that?
I think for some people it's fear, fear about what it means, what the impact will be, how people will think about them, what the impact will be on their work. I think what's most important is for people to understand that if you're concerned about yourself or you're concerned about someone who you care about, that you can have positive action on someone's life, that you can have a positive impact, that you can talk openly about these issues and help people get access to the resources that they need.
And that's the theme of your upcoming gala, Talk About It.
Yes, that's exactly the theme. We are very excited to be having our 25th anniversary gala on June 7th at Gotham Hall, the theme of which is Just Talk About It, which is really all about breaking the silence around mental health issues and honoring those who have bravely and openly come forward to talk about their personal struggles, thus leading to help and hope to thousands of people who are in need. And so we hope by setting the example and opening the conversation that more people will be able to take action to achieve wellness.
I suppose talk about it is easier said than done. If you're someone in New York who perhaps feel you're not quite yourself, but not sure where to turn to, fearful over the costs of getting coverage, getting help, what do you say to those? What's the first call they can make? Who's the first person they should turn to?
So if you're concerned about yourself or you're concerned about someone who you care about, you can reach out for help through NYC Well, New York City's free, confidential access to behavioral health resources that provides mental health supports via text, call, and chat 24 hours a day, 7 days a week.
So no cost involved. And who will they be speaking to on the other side?
So they would be speaking to a trained mental health professional who would listen, provide support, link them to resources, and also follow up with them to make sure that they're getting connected to the care that they need. So you can reach out anytime, day or night, call 1-888-NYC-WELL, or text WELL, W-E-L-L, to 65173. It's easy, it's free, it's confidential.
Let me turn to another issue we've been following closely here on this program. That's the issue of homelessness. The numbers have risen in recent years here in New York City. The statistics suggest that there's a correlation between those in the shelter system and the prevalence of mental health illness. 40% of discharges from state mental health institutions, those people, 40%, still don't have an address 6 months later, a place to live. Almost 25% of New York's adult shelter system are severely mentally ill. What are we doing here in New York City to help this particular population?
So mental illness and substance use challenges can contribute to homelessness, but the biggest challenge that we face is housing and the lack of affordable housing. The housing first model, which helps individuals rapidly exit homelessness and gets them connected to a stable housing situation, has shown really positive outcomes around helping people regain stability in their lives. So we have a solution, we know what to do, but given the unprecedented figures, we need to accelerate and expand efforts around affordable housing.
Before I let you go, that number one more time that people can reach out to.
1-888-NYC WELL, or text WELL, WELL, to 65173.
Kimberly Williams, the president of the Mental Health Association of New York City, thanks so much for joining me.
Thanks very much.